to start with the basic things of allopathy, homeopathy, alternative sciences. I've studied 117 alternative sciences in finding what can I get the best to treat my patients, because I only remember one line of Dr. Hahnemann: physician is born to cure the sick, and his only mission is to cure the sick. And that's how we should go and find out. But my journey started from an allopathic background. I was a very staunch allopath, not disbelieving in every other therapies other than allopathy. It was a very hard time for me to accept homeopathy, Ayurveda, alternative therapies, and I was dead against everything. That's not a fault of an allopath, because he's so trained hard. Means you can literally say that morning 5 a.m. till night 1 p.m. I was working in a 24 hours, 80 patients
Sir,
lying.
sorry to interrupt you, sir. Your voice is not audible.
Can you hear me now?
Yes, sir. It's clear.
Thank you. Is it
Please
audible now?
continue, sir.
Is it audible?
Yes, sir. It's audible.
See, basically, when I started my allopathic practice, it was a very staunch allopathy ideas and views about not having entry to the other alternative sciences, and started my nursing home where I was a roaring allopath with a disregard and disgrace for other alternative therapies. But after my mother was very sick in my own ICU in the last stage, and given up hopes with single dose of RSIO, she recovered. That ignited me and that broke my ego as an allopath. And from there, my journey started searching for the other therapies also. My mind was opened and my eyes seeing that there are so many good things available outside the allopathy, and where allopathy ends, the other therapies has a beginning also. And the first experience was with homeopathy. It was so happiness that is I found out that mechanized gold, the movie where they find a gold mine and they were happy. I was happy that every small things which we were rejecting in allopathy as an psychosomatic, those psychosomatic symptoms were nothing but very peculiar, specific, peculiar symptoms of the mind. And there are remedies, and you can find out through that. But I was very new, and therefore I started after that practicing in my own nursing home, a patient of heart attack with acute myocardial infarction, inferior wall extending to anterior, going into cardiogenic shock, BP not responding even to dopamine drip. There was a time of, it was a complete heart block. Putting a pacemaker was only the way out, and otherwise this patient is going to die. But they were not affording pacemaker implantation because it was costing huge, and the thrombolytic therapy that was costing huge, 20,000 that time in 1995. So I gave one dose of Arnica 30 followed by Cactus G60. Cactus G60 is a sorbitrate of homeopathy. It immediately saves the person, and Arnica dissolves the clot and plaques. 3 doses repeated in a day, and in the evening the ECG was normal, which I had never seen in my ICU practice. I had 20 patients admitted in the ICU with myocardial infarction, but such a magical response I had never seen even with the thrombolytic therapy. And the complete heart block disappeared, and patient was discharged on 5th day because they were not affording, and he said, I am fine. The case of status asthma, I start giving single dose remedies along with allopathic prescription, of course. And the treatment was going on, Derifylin drip. She was not responding even to steroids. And finally, I came to know that this exacerbation of asthma was because of emotional excitement, because the son ditched her, who was to stay with her, and he left her. And that excitement, emotional, gave rise to status asthma, requiring a ventilator. I was arranging for ventilator. I gave a dose of Coffea 200. And coffee at 200 single dose, this lady settled so nicely. Within minutes, unimaginable, unimaginable. And no one would believe. Even I was not believing because I was waiting for ambulance to come and I went to her room and she was deep asleep and snoring. A status asthma patient snoring. It was a surprise for me as a pulmonologist. And that increased my confidence more and more. And there were so many cases. I think days they will require for me to share all my successful cases. And finally, I said, ki now I have to be an homeopath. And I was practicing only on a clinical basis, not on a classical basis. So my journey started on a clinical basis. I took admission to the BHMS college. From there, I got my degree. Then I first time knew what is an organomy. And then after that, what is a classical homeopathy, single dose remedies. I started practicing and I was getting success, but the reproducibility in all cases were not there. So in some cases, you're getting success, some cases you're not getting success. So that was again starting a point of a rethinking. It's what is to be done. One day, a case of terminal stage of cancer, metastasis everywhere, primary not known, with ascites and gone very thin. And I was treating him with my single remedy and this, and he was not getting results. Finally, he stopped my treatment and he went to a homeopath in Mumbai nearby Bhiwandi. He was a normal homeopath giving multiple therapies, all 5-6 mother tinctures and all those 2-3 remedies in a date and time. I said, this is wrong homeopathy. This is not a correct homeopathy. But to my surprise, he came back after a 6 months time and I see that all the metastasis ascites is gone and he's a normal man. He said, just give me a medicine so that I can get some energy. I was surprised to see. Then again, it broke my confidence that how I couldn't succeed and he succeeded because he was dare to be wise. And then I thought that these are the irreversible cases, irreparable cases. And in this case, we need a different approach. And giving multiple remedies at different times was okay because I'd seen the results in him. But I was not in favor of multiple remedies because, in studying homeopathy, it is always a confusion. What is right? What is wrong? This is right. This is wrong. And there were no clarity. I searched all the books and places. Somebody saying what? There are difference of opinion, theorization. So that was a crux. I thought that homeopathy needs a proper scientific proving. And after that, you can get this to this proper systematic way of prescribing. The reproducibility with there should be there. When I was appearing for my BHMS exam, I asked my fellow students there, fellow colleagues, I cannot call them students because they were appearing with me. Okay, after passing final year, what you are going to do? They said, I'm going to do allopathic practice. I said, why? I'm an allopath, I'm MD, I have come here and giving my exam of BHMS after 17 years after my MD examination. Why you want to practice allopathy? They say the results are not consistent and it's very difficult. And there are a lot of things which are confusing to the students. Then I could see, yes, there are problems. Reproducibility is the problem. The success rate means even if you create 10 cases like this, you get success in 2 cases. You show up in seminars, webinars and say, homeopathy is great, but what about the failure cases? Then I started saying whether homeopathy has also got a limitation. Therefore, I started searching all other sciences. But finally coming to a point that there is no replacement for homeopathy because it works directly at the root level, root cause of the disease, and that is the disturbed emotions and mind. And the physical complaints can be treated clinically with other corresponding partially similar remedies. And even that I was finding what this is right, this is good. Am I doing right homeopathy? Am I doing wrong homeopathy? Then finally, a voice came to me during the COVID times. I started giving single remedies or 1 or 2 follow-up remedies, and patients, even though well-selected remedies, were not acting. And finally, the patient is to deteriorate, go into the ICU. Finally, my wife was sick with 8% involvement of the lung in the first epidemic of COVID. And it was a nightmare for me. I was treating her and giving remedies. Pulsatilla was her remedy. She was responding, but she was deteriorating. The oxygen was dropping. Finally, I said, nothing doing now. I have got no choice than to give multiple remedies. Not mixing together and giving, but different at 1 hour interval, 20 minutes interval, 15 minutes, as per the symptoms they came. And finally, within 48 hours, she was stabilized. Oxygen came to 98. And we had a CT scan done. And finally, I said, I lost the other patients because I couldn't get the time and this wholehearted support, which I had in my wife's case. And then I changed my scenario, dare to be wise. What Dr. Hahnemann has said, dare to be wise and act according to the situation. And I started acting. And then I could treat thousands of cases, hundreds of cases on a ventilator. I've seen they are coming out with marvelous results. And I became more and more known to be a COVID doctor that time. And what Maharashtra government gave me an award only when they had seen all these cases recovering. So this was my thing. And this is how I came to a conclusion that we need to change. Homeopathy is 200 years back. That time, blood pressure treatment was bloodletting. Now, so many drugs have come. The man is polluted. His vital force has gone down. His vital force is polluted. And with single remedy in this, they may show response, but not to a large extent. And many patients then halfway, when they deteriorate, they go to an allopathy and they say, see, homeopathy has spoiled your case. And this is what we have to face the trouble. So I started learning with the difficulties and finding even that there was a opposition during my first COVID presentation that how many you are given too many remedies is not good. I said, instead of dying, giving remedies and curing is better. So many homeopaths have been lost because of this. And then second wave, I didn't give this protocols. And one of the doctors said, sir, you are not given a takeaway protocol this time. I said, there was a criticism. No, sir, because of that protocol, so many people were saved and they came out of this even without taking a history properly. So I said, this is a need of the time and we need to research. We are at 200 years back, homeopathy is same. No doubt classical is the best, but it's not practical in all the cases. So we have to see the times, judge the patient, act wisely and dare to be wise. So coming to the final thing, I'm going to share my screen and we will just I'm sharing my screen and if you once you can see the screen, you can tell me. Can you see my screen now?
Yes, sir, we can see the screen.
Okay. So I go up to the first case I take up as tuberculoma of the brain. Tuberculoma of brain is a clinical manifestation. There are a lot of tuberculosis, but in this case, it was only a single, and that was growing rapidly, and patient was going into seizures and other symptoms. The symptoms are based on where the lesion is situated. From here, I understood why there are certain specific symptoms in homeopathy. As per the pathology, there are symptoms, and as per the physiology and immunology, there are characteristic symptoms. So pathology is also important, and this is also important, and PQRS symptoms are also important. If you get the PQRS and classically emotional and mental symptoms, it is one of the sure shot prescriptions in the remedy. But in the cases where you don't get, what you can do? So the tuberculoma with many types of tuberculoma and different symptoms, even in allopathy is said where it is situated as per the symptoms will come. So it's in a case summary, patient of tuberculoma came to with deviation of mouth from left to right. There are right-sided headache about the right ear, right eye, nausea, vomiting, better after vomiting. Better after vomiting, why? Because after vomiting, the fluid pressure is reduced and brain edema goes down. So, you have to correlate every symptom of given in the homeopathy with the pathology. Why he is better after vomiting. Now, better after vomiting in the stomach, the irritated stomach, inflamed stomach, vomiting, you feel better. So you can know what is the diagnosis inflammation of the stomach, and you can take corresponding rubric from the stomach inflammation, and then join with the PQRS and join with the mental symptom and find out where the remedy fits in. And if the remedy fits in all, that is the best, but hardly you get a time when one remedy fits in all the symptoms. So it is like a mind-boggling thing while analyzing a serious case. She was a 47-year female teacher, and she came to me with the chief complaints. I have written this with nausea, vomiting, vertigo, occasionally weakness present. This appetite reduce, aversion to curd, sour, spicy, urine is normal, stool normal, sleeplessness, choking sensation, vertigo, sleep during. All these symptoms were taken and repertorized. And finally, if you can see that the mind level, the stress-related hard work, the main important emotional upset was that her only son, who was going to America for studies, and she thought that he will go and then he will not come back and she will be left lonely. She said, there is no need, there is education in India, why you want to go? Because of that, and care and worries for him, he's been fed by me all throughout his life. Who will take care of his food there? And with that, continuous stress and the grief and feeling homesickness before he goes was a state of mind that was most important, needed to treat. I've seen in tuberculosis, there is a grief with fear. When there is a grief with fear with shock, cancer cases arise. When there is only fear, the acute cases will arise. There is only grief, typhoid cases will arise. So during the practice, I've seen this emotional stress, how they are related to the different sorts of disease. So in her nature, she she didn't like people speaking lies, and was a creative, sensitive in nature, and fear of seeing dead bodies. So she was a frightful person with desire for cleanliness and good at learning the new things, cannot stay alone, needs company, fear of snakes. She was started treatment with homeopathy. A set of medicines were given, which we'll discuss later. This was a time when we did the doctor who was treating, Dr. Yashashwini, she had put her on anti-tubercular treatment, seizures treatment, and steroids. But steroids cannot be given more in tuberculosis, so they were withdrawn later on. And that was a small size that was noted on the CT scan. Sorry, it is an MRI. Hypointense lesion with thick wall, enhancing T2 flare images, hyperintense walls, and irregular margins is noted in the left frontal cortex. So on the MRI done on 1/8, the tumor size increased. It not only increased, but the increase in the size lesion with another small lesion with small localization and thick walled, enhancing lesion seems superior aspect of the original lesion. So, in tuberculomas, the lesions, they spread at different parts of the brain. And finally, the patient goes into meningitis. And then when the ventricles, they block into hydrocephalus. And finally, when they are not responding, they go very bad. And she was not responding. So with that, all things and second report enhancing, she came to us. And we started her treatment of homeopathy on 9/8/22. Finally, after in 9/1/23, tiny, the whole tumor size reduced to half, 5.4. And the original, which was new lesion that had come, that had completely resolved. And resolving infective granuloma like tuberculoma with homeopathy, when it was not responding to anti-tuberculosis treatment and all those things, in 5 months' time, it reduced to half the size of after the homeopathic treatment. And this was really encouraging. So if you see the MRI brain that was done on March 23, The MRI brain with contrast does not reveal any significant abnormality. That is what I was telling you. That is total in 5 months' time. This lesion was completely resolved. You can see MRI brain does not reveal any significant abnormality. There is a complete resolution. Now, then I went to an PubMed to see what are the lesions. You can see I've taken one management of intracranial tuberculous mass lesion. How long should we treat for from PubMed? And this research paper with abstract shows that the treatment response is unpredictable, but it is predictable with homeopathy. With lesions frequently enlarging paradoxically, here lesion appearing resolved immediately in 3 to 5 months' time, persistent for many years despite TB treatment. Here the lesion sets totally disappeared and corticosteroid therapy was not required. The most international guideline recommends 9 to 12 months of course. Even then the shadows, they don't go, and many a times the hard mass is seen. So they say that even after stopping tuberculosis treatment for 9 to 12 months, that can stay, or that can, the tumor can become tubercle bacilli negative, but tumor can say and can have the different types of symptoms of seizures, headaches, vertigo, and all those things. Here with homeopathy, complete resolution was a success story of homeopathy. And that's the reason I love homeopathy, that it gives such an immense pleasure of treating and curing such patients. These were the symptoms I have given you, because you may ask me how you have arrived at this diagnosis. So we have taken the pain, temple, vertigo. These are only the symptoms. You cannot see any mind here. And from here, you know what is my way of thinking? From 1 to 18 remedies, whatever comes on the way after giving a constitutional treatment. One dose cannot cure such patients. It can cure, I don't deny, but it takes a very long time. And in that, if patient deteriorates, you lose the time, you lose the case, and it goes to another pathy, and then homeopathy is blamed. So what is my way of thinking is, Dr. Hahnemann said, rapid, gentle, and permanent. So rapidity was not seen in the usual practice, wait and watch, give dose, single dose, wait and watch. And in that, patient goes bad, they stop the treatment, starts other treatment, and homeopathy is labeled as a failure. In some cases where vital force is good, single dose remedy works and the patient goes well, patient settles down faster, but it doesn't happen in all cases. And therefore, this is the practice that I've changed after my experience, that you should be broad-minded. I was a staunch allopath, then I became a staunch homeopath. Staunch homeopath means not ready to accept other thing what has been said in the boxes. So you should always think out of the box. Nothing is wrong, experiment and think. And see if finally, if you are getting the results as per Dr. Herring's law of cure, and patient is getting better and better, nothing like it. And that's the reason that I get always think in the mind that never think you are wrong. Go on doing till the time you are not damaging anyone's health. So this was a mind taken with generalities and everything. And finally, if you see the characteristic pain, that is writing, back pain, continued writing after. And this was a selection point of sepia as a constitutional remedy. The other remedies that I had given, because she was feeling homesickness, ignatia, 200, calcarea phos, 30, arnica, 200, injury caused by the nearby brain tissue. Now you that lesion which is there causing compression, perilesional edema is causing a compression damage to the nerves. Aconite, whether she will survive, whether she will, she said, sir, I do not know whether I will come out, what will happen to me, if something happens to me, what will happen to my child, fear of death. Her in-laws were speaking bad to her, and therefore Staphylococcus 200. Muriatic acid was given for general weakness. She was a mother with a lot of muscular weakness. When the muscular weakness comes, usually they respond to this. Plumbum was a pathological prescription, which was always in the brain neurological cases. I have seen regeneration of and getting total proper clear of the shadow from the MRI, not leaving even the residue of the scar, was what with the plumbum metallicum. Veratrum album, the dizziness with low BP and perspiration on the forehead, This was given in 200% potency whenever she is to get the symptom. So what, give this remedy 200, not regularly, but at a SOS, dizziness SOS, so that, patient need not contact you. You should predict what is going to happen, what symptoms are going to come. You should know all those things and give in advance the SOS remedies. If you get this, then only take it. If you get this, then only take it. And they happen, they take it, and they get better. The time is not wasted because they contact us, then we are available, and then the time is lost. By that, the dizziness increases, and she lands into allopathic hands. And then they say, homeopath has spoiled the case. Carcinosin was given a nosode because she was so neat, clean, sensitive, meticulous, and very caring, affectionate. So based on this, carcinosin was nosode given because it was covering almost all the miasms. So after in 9/8/22, 31/8, that is almost after say 20 days, we see there was overall mild relief, back pain reduced. Deviation of face to the right side didn't happen again. So there was a mild response. With deviation stop means the pressure on the pressure of the tumor on the nearby was reduced, and therefore this deviation was coming to normal. From there, again in 20 days time, there was overall 40% relief. And on 3/10/22, she was feeling much more better than this, and menses appeared. Only there were mild jerks while sleeping. So 21/6, the overall condition improved, but had abdominal pain during menses, weakness. Again, colocynth was given for headache. Belladonna works for the congestive headaches in tumors very nicely, provided if the patient says there is some suddenness of the pain. But you may not get many time characteristic symptoms. Some of the symptoms they will match, but overall, if you see this with heat sensation, headache, and suddenness, belladonna works much more better. But if it is a chronic headache where we see that the covering, that meninges are involved, particularly meninges, or the scar tissue in the brain tumor or in any brain conditions, Ruta-G works better. So we must know about the pathology of the remedy also. We go in homeopathy in a very different style, but that style may not work all the time. It will give you success, but not in many cases. So the percentage of success, if you get 10 cases, how many cases you are in a position to cure or give the 100% relief without requiring any other support of allopathy? So that is most important. And in this case, particularly the efficacy of homeopathic medicines were seen in treating tuberculoma. She never underwent a surgery because this was increasing, and finally she would have required a surgery, because after giving tuberculosis treatment, they were saying then when the tuberculosis bacilli have gone, then remaining tumor can be excised. So we saved the surgery, homeopathy saved the surgery, and patient was symptom-free, staying in a healthy lifestyle. Miasmatic analysis was also included. There were no complications during the treatment, and we were reviewing the case off and on, and but there was no recurrence. And that was the effectiveness of homeopathy. Now here, what we have to see, basically we have to see the progress of the disease, because many times we have fear that something, another thing will emerge out. But when we have used the sequence of the remedies, I have never seen any aggravation or patient going into some bigger problems because of suppression. That can happen with single remedy in some cases, not in all cases. That is my observation. You may differ, but what I am saying is, out of keeping your eyes and open and with broad mind and thinking for anything that is required till the time the patient is not harmed. That is most important. And according to me, I have seen homeopathy never harms a patient. Some cases you say this has happened, but it is all the coincidence. Number of cases happening. One in one of the seminar in Gujarat, one doctor said that patient died because of sudden prescription of Arnica 1M. I said, how can a person die with Arnica 1M? It might be a coincidence. So, this lot of theorizing in homeopathy has caused a problem that homeopathy is behind. come to the second case, that is prostate carcinoma. This is an old man, 65 years, came with a prostate carcinoma, and it was metastasis to the lungs as well as the skeletal region. And after giving homeopathic treatment, you know, he started improving. So he was told to go for a chemotherapy, but they said that the spread is to the liver, to the lungs, and to the bones, and you will not recover. And therefore, you may recover, but there are a lot of side effects. And he said, I'm an old man. I lived my life 6-7 years, doctor. You give me homeopathy, and whatever will happen, I will accept it. And we started giving homeopathy, and that you see the rapid regression of the prostate cancer. Rapid. See, rapid is a very important word. Prevention of recurrence, regression of the lung metastasis, and improving the general quality. That what we got a success. Only thing what we didn't follow, because the pain was better, even in the skeletal region, we didn't do any MRIs and scan, because there he said, please don't investigate too much. I am feeling better. So we had a limited chance of investigations. Only what we could investigate, it was only the PSA and X-ray chest and CT scan. So the edema feet, poor appetite, weakness, breathlessness, numbness of lower limb, that came, that also responded to corresponding homeopathic remedies given as per the symptom that time. So life sphere, if you see in this, he was a cheerful, lively man, gives money easily to make others happy, talkative, likes to praise people, mix with them easily, positive and strong. He brought a very good overcoat for me, that after getting well, and said, sir, you will always remember me because you have given me pleasure. Because of that, I am not going into any bedridden condition. I'm moving, I'm enjoying my life. And this was a result of a homeopathic treatment. Even though he had an bilateral lung nodules with rhonchi and wheezing and everything, that responded to antimprat very easily. And you see the chest CT scan, which was done on 29/2016. A nodule 5 to 21 millimeter lung base, the largest nodule in the right lung base. This. So these two in the base. Later on, the bilateral there were lymph nodes also enlarged, and largest node was measuring 30 to 2.4 millimeter in pretracheal region. Prostate enlarged into the size, and the largest measure of the nodular deposit seen in periprostatic region was 17/20 and 8 to 9 millimeter size common iliac node, with few centimeters size retroperitoneal nodes were seen. In short, the spread was very high. And then when we started 26, this was also one X-ray was taken, because every now and then you can't do the CT scan. So X-ray also showed, plain X-ray also showed nodular densities in left upper, right mid zone, and bilaterally prominent hilar and parahilar shadows. So he was treated with homeopathy, and 28/11/17, both lungs fields are clear, hilar mediastinal glands are not enlarged. That was a marvelous recovery that we got from the homeopathic treatment. His PSA was 184, and within the duration of 2 months treatment of homeopathy from 6/12/16, it decreased to 120. So from 184, it decreased to 120, and from PSA from 120, it reduced to 20.3. Faster reduction in just 1 month's time. So initially is always, you see, even in the tuberculoma case, where initially we go slow, give less remedies, but as soon as we include the pathological remedies and other remedies, you can see the progress coming to the normal more faster. See, from 120, from 180 to 120, 60 reduced, and from 120 to directly 100 reduced, and therefore further to 8.5, and in next 2 months. Took 5 months to become normal from metastatic state. This is the rapidity. 5 months treatment, in 5 months, the widespread cancer coming to almost complete resolution phase is a real marvelous action of the homeopathic drugs. And he then later on developed a urine infection. You can see the pus cells there. That was mild and fever was there. So we always treat fever as per the symptoms that come. And according to the acute similimum, we give the remedies, even if you have to give 2 or 3 times. The repetition is based on the what is a symptom response. If the patient fever is not responding, I've always told that fever should respond within hours, not in the days. The right remedy given, the 0.2, 0.2, 0.2, 0.2, every hour I tell my patient to measure the fever. Sometimes every half an hour, and if the patient fever is not reducing 0.2, 0.2 in a, you are giving a remedy that is not going to work. You are going to kill the time and patient is going to leave your treatment. So the close observation, the meticulous observation, the involvement of yourself into the case is very much required in such acute cases. For this, we were given a Merck salt 200 and Cantharis 30. This works wonders. And, with that, he showed a complete recovery from the urinary tract infection. So from more important organ to less important organ to the excretory organ, the disease has traveled from there to the bladder. So the discharges were in form of the pus. That also we treated. Therefore, because we wanted a faster results. And after that, on 1905, he got the eruption. And this was as per the Hering's law, from bladder to skin. So you see how wonderfully, even with a constitutional remedy, number of remedies were given that I'm going to show you later, how this case arrived at the cure with the Hering's law of cure and coming to the skin. And here he started applying ointment. When he started applying ointment, again the PSA went up. And again, then I had to shout at him and tell him that you want to leave. So, sir, doctor, I cannot sleep at night. Here is the place where I don't treat. I try to give only either opium or chamomilla for mental, whether he is not tolerating itching as per the symptoms. But any remedy given towards the disease of the skin can cause a problem that I have seen. So there I am very, very, very careful of not giving remedies that will cure unless it is very, very irritating. To a large, I wait for 1 month, 2 months. Patients are shouting. I tell them, if you do this, you'll go bad. Then there is no treatment with us. Then you better go to allopathy. And therefore, there are other cases which I had taken, but time is short and I cannot show all those cases. These are the mind symptoms and other symptoms taken for him. And you see that 2611, all these symptoms, he was prescribed Conmac 33 doses on 3 consecutive days. Kalibich was given for sticky cough, and opium 30 I always give in all cancer cases, because the fear and fright, whether they say or not say, is always there. And many a times where I have forgotten to give this opium 30 as the empirical medicine, the results were slower and not very good. Spongia was given again at night cough, and at night, he used to think of all old things that was happening, and therefore the Spongia was given. These are the whole repertorization done. You can see Konam was standing front, but now you see other remedies also. Staphysia is there, Cilicia is there, Tuja is there, Sepia is also going. Now what we got into the constitutional, it had into the in first case as a constitutional. Here it has gone in the congestion, the same phase on the 14th. So, arnica is there. Arnica is a damage to the any injury, whether it is a particularly ischemic injury. Arnica is ischemic injury, and that one has to know very well. Ischemic injury can be because of pressure, can be direct injury for anything. So ischemia is a very important factor. If you can't see in arnica, you will not get a result in that. And for the particularly cough, you can see the Kalibich was standing prominent, so we had to give him. And this is very important, because if you don't give these remedies and just wait and watch, the length of patient takes to get well is very longer. And many times, because of some severe acute illness that come in between, patient may leave the treatment and go. Spongia also taken different. Whenever this they come, the difficulty, exertion, and this taking with all the mind symptoms, most common was fitting into the spongia. So overall 5%, 1 to 5% relief was there, but Staphylococcus aureus after adding that, which he had felt bad after mortification with the problems with his son. And you can see the repertorization of Staphylococcus and 16, 12, 16, the appetite increased, but the numbness of the nerves of the both limbs started. Breathlessness, there was relief, cough, there was relief, but now it has shifted to nerves. That was not good. So here you have to immediately act, and hypericum 6C was fitting into these symptoms, and as a pathological remedy, started giving daily for 5 days at 4 p.m. And I've seen many a times, and then we increased to hypericum 30 when he was not responding to hypericum 6C. And finally, everything was relieved, even the numbness in really 20 to 30% relief. Overall, there was 20 concern about obesity, appetite. Now, she is concerned about obesity, not of the disease. And appetite was increased. Even then, after that, the 13, 117, you can see the weight reduced 3 kgs. Now, this was with energy, but there was some breathlessness for which we had given him anti-tard breathing SOS. So whenever he used to get breathlessness, and he used to feel better with that. And now the symptoms have started coming down. And that after that, repeated episodes of this, even at the start during the lung metastasis also, these symptoms were there, and finally the anti-tard cured. Antipsychotic remedy Tuberculoma was given because he was maybe improve that way. And after Tuja, that from syphilis to psychotic stage to the psoric phase. So when he came to psychotic phase, that time Tuberculoma was given, and you can see overall 80-90. You can see the figures how they jumped to 80-90, and therefore giving specific remedies, giving pathological remedies, when to give, when not to give, how much is to be placed. The distance between two remedies is always important. And, we should be very, very active, and we should be dare to be wise. And even if you have to many times take a decision of changing a remedy, it should be faster rather than waiting. Because in such cases, waiting can spoil the case. That is my personal thing. And if you see then again in the research of homeopathic preparation on prostate, okay, scans cellular and growth, you can see that how Tuja has been given, Sabal cellulata, Conam maculatum. So, then I saw, okay, I have done so much of an exercise in finding out the remedy, and I'm seeing that it was finally what helped me more in the cancer was Conam and Tuja. Other remedies were used for other symptoms so that his life was comfortable. He was moving, enjoying his life, not bedridden except for the itching. So these are the type of researches that has always attracted me, that we have to change our thought. We cannot be in the old thought process. We need to be scientific. We need to produce the results consistently. Whatever the treatment designed in allopathy, you see any Tom, Dick, Harry doctor of allopathy gives, he gets a result. You go to any doctor, he gives paracetamol, every patient's fever comes down. Unless now that is not correct, they go into another problems. But here, if you give proper remedy in a proper way, with daring to be wise and taking the decision rightly as per the clinical symptoms that come, the things can improve. Because you cannot be a staunch person, not trying to change, hard person, not trying to listen to what other things are there. Things will change, and many times this hardcore people, even in allopathy, they die. Even in homeopathy, they succumb because they don't want to accept the change. They don't want to accept what is the right and what is wrong, what is given in prescribed in the books, what is being said may not be always right, may not be always wrong. what my teachers during my MD time, Dr. Farooq Dastoor, has taught me by hitting on the knuckles. God has given you brain. He asked me a question. Yes, sir. Yes, what you said is right. I said, because I'm a boss, you're saying right. Think from your own angle. He gave me a perception in my mind. Don't go by the books. Don't go by your bosses. Don't go by your own experience. And unless that is what is a doctor's life. And doctor has to be open and changeable and malleable and acceptable. And because of that, I had developed so much of confidence that I said, in one case, there is a subdural hematoma that can be operated and patient can be saved. But because I was a very junior resident that time, all the senior registrar, lecturer, and everyone said, no nonsense. How can you order? That time CT scan was not there. So carotid angiography we used to do to diagnose the cases. How can you order such a big investigation without asking your seniors? I said it was a night time and there was, I had sent a call and there was no response. So I directly ordered this. And that radiologist there also said, it is written by a junior houseman. How can he write such a big investigation? And finally, he didn't do because he wanted an order from the senior lecturer and the registrar. That was not done. I had a fight. And finally, they did all nonsense investigations. And finally, the patient died at postmortem. It was a post-subdural hematoma that I had diagnosed. And thanks to Dr. Farooq Dastoor, who taught me to be wise and use your own brain. What is taught in the books, what you are seeing, you should always keep your mind open and act wisely. Then coming to the, there are, I think time is a factor where I can show a septic arthritis case. This again, this a young boy lost the love of his life, the girl with whom he was going. And finally, she married to another man without informing. It was a shock. It was a love disappointment. And finally, he landed into a knee pain. Knee pain means, the stability is gone. He cannot move. He used to say, she is my life. You move around her, and the whole thing was gone, and the knee got affected because of the grief. He got septic arthritis, and below that, from the joint, it used to get down. And finally, he landed into a very big problem. So I'll skip all those things, come to the final thing, that how a man with this stature of problems, with knee replacement, debridement was the thing which was given to him. And he said that it's at such young age of 26 years, his knee was getting destroyed. You see moderate effusion with so much of supraparietal recess, abscesses, damage of the cartilage and everything. Finally, he was given homeopathy with osteolytic changes, also subchondral portion of the midline and femoral condyles. We see the extent of involvement, and finally he came into again a problem. Third time he was told a surgery of knee and debridement of the calf. So I said nothing doing with that. We have to go by this homeopathy. And when I started giving him this wound, which is there, you can see, I was against dressing, keep the wound open. So what we had done, we put a scospice here and a sticking plaster. So whatever drains comes into this. I wanted everything to come. That happened without doing a surgery. The nature surgery started, and you see the big hole was created after the homeopathic remedy, and it started discharging. And so I'll show you the next. With this, you can see particularly so much of the dirt and pus started coming out, and finally, see now 28th June, after 7 days, 28th June and 30th June, you see the hole started going down. The lesion had spread from here to again here because this was discharging more. The area increased, and then finally it started reducing. You can see the redness has gone and the white epithelium starts coming. Then you can be very sure that you are improving. In between also it can cause relapse. So you see this particular depth here, and you see that is getting filled up. So you have to use your clinical knowledge, acumen, to see whether you see the size and shape of this, and see the size. It is constricting and going down and down and down. And finally, 11th July, 14th July, 17 July, 18 July, 4 days time, 5 days time, you see the marvelous improvement. This man is 28th July 20, means he's ongoing the treatment. And this is the last that we got, particularly day before yesterday, a picture from me. I said, I want to present your case. See how fast and how better homeopathy we can do. And he's walking and he's much, much, much better. Finally, he was given Ignatia on 200 on day one due to ailments from love disappointment. Opium was given shock. He was shocked that his girlfriend got married. Merck salt 200 was given as a miasmatic treatment fitting into the analysis, repertory analysis. 1M was given Epersol for separation, because after Merck salt usually it starts the giving Epersol, brings out all the pus. Lidempal and clematis, they are best to resolve the wound, take the pathology out, and pathological remedy was alternated. Ignatia was repeated every week, followed by fever. Pyrogenium 1M was given. He didn't require more doses because he didn't get only once. He got a fever with pyrogenium. He settled down. Finally, was fine. Severe pain when it used to come, Bryonia 200 was given. Slightest movement pain, Bryonia. So, these are the snapshot prescriptions given on the single rubric remedies. And you can see the vertigo stopped, wheezing stopped, and everything improved very nicely. So homeopathic medicines acted as a homeopathic surgery. And such a wonderful job what homeopathy does is unbelievable. There is another case of COVID pneumonia, particularly what I want to show in this. He was at home, he was a headmaster. He said, all hospitals are full, oxygen is not available. And if I go to a hospital, I'm going to die. And finally, I will show this case little fast because I want to show what homeopathy can do. He came to with 94 oxygen. He was deteriorating fast. Here again, I was doing the same thing, giving single remedy, waiting, and patient started deteriorating. And that time I say, nothing doing, give all the remedies that you are seeing and you are forecasting what will come. So I gave Ferrum Phos because it was acting on the inflammation of blood vessels that time during COVID time. Carbovage for oxygen, Bryonia for cough and pneumonia. Arsenic album was given as an antiviral remedy. Antim tart was given because it was going into pneumonia. Aconite, every COVID patient was afraid. So wherever I had given aconite as the first dose, those cases are saved. Lachesis was his remedy, and therefore it was a constitutional remedy, but not responding to that when I was giving a load. So with all these remedies, he started improving, and I can show you. See, means before that, giving all those, his oxygen deteriorated up to 65, 62. And one record is not there, it was 40. And that was a time when I was afraid. I increased the oxygen cylinder was there from 4 liters to 5 liters. I said, now you go to hospital. But he said, no, doctor, I'm going to die at your hands. You do or die, whatever you do. Finally, I had to give all these doses and see, there are other reports of this coming back to 67, again, sometimes going back down to 91, 92, and 5th day onward, he started responding after washing day 8, day 9, and finally he came to 92, 96, 95 sleeping position, and the breathlessness went away. The same remedy were repeated. You can see day 10, I'm giving all remedies. Chilidonium was added because pneumonia was not resolving, and in the resolution phase, chilidonium was a pathological remedy that. So I acted wise, and then one dose was introduced as tuberculum 200 because I was not getting that fast results. And finally, he came to on day 12. You can see the day 12, 98 on 1 liter, and after short walk, it was 90%. And day 13, without oxygen, it was 98%. After 15 minutes walk, it's to go down, and after toilet still. So we know from this, once we come to 98, we'll say, oh, now the patient has got well, so we should relax. We should not relax. We should see all these things to find that 100% you should be sure that patient is out, and that is where the clinical knowledge is required. And you can see this man He was the breathless. That is the first video. He was breathless at home. And finally, you can see him walking with good. And these are the results. Such patients have died in ICU. They didn't require a ventilator with just 2 to 5 liters of oxygen at home, cured and brought to the normal. So that is what is most important. We go to in a short, very few small cases that I want to tell you, because I was told that I'm only the speaker and I want to give justice to that. So I said, let me take all other cases also. You can see the vocal cord. You can see this such big tumor, and this responded to it has again gone down. You can see there. You can see that big tumor has reduced in a span of 7 days time. In a span of 7 days time, he was told, sir, biopsy. I said no biopsy, because from the gross appearance of that tumor on the vocal cord was 100% it was a cancer, because I will tell you why it was a cancer. And now you can see this. There is some, the computer has got hang, and we'll come to that immediately. Just a minute. Yeah, this is another case of vocal cord tumor. You can see. This first case that I showed you got resolved in just a month's time. This took me 1 year. This was by single remedy, not repeating quite frequently, wait and watch, wait and watch. It took 2 years for me to resolve the same case that I'd resolved with my new technique. And you see the whole, this thing has been as if someone has done a surgical excision from here. This was a fold where this tumor was there. And you can see even this, particularly in duration, and whitish plaque here, that is also gone. So I learned from my experiences, mistakes, being rigid, then become broad-minded, then becoming flexible, accepting, not bothering, because we are only working for the patient's sake. And she was a case of craniopharyngioma, operated so many times, finally left to die. The mother came and asked me that give her some remedy that she will die as early as possible. We cannot see her suffering. A dose of Moschita 200. Initially, I had given him given a different remedies, and now I see what remedies I had given in. When I give final remedy, if that I would have given first, even in that comparison I have done in my practice. Now I say ki we have to use judiciously, complementary and follows of well remedy in a shortest possible time to give the effective, quick cure to the patient. You must have seen that. See the gross difference. She came. Only thing what she couldn't do was she lost her eyes because optic chiasma was destroyed by the tumor, and she got admission into computer, and she stood first as a blind person getting degree into computers in Pune University. This was a case of C. esophagus. In 3 months' time, you can see no significant abnormality. That was possible only because of homeopathy. This was a case of CA ovaries widespread everywhere, and she was given Silicia 30 was a constitutional remedy with Abrotenum 200 whenever she used to get pus, inflammation of the intestine, inflammation of the peritoneum because of the metastasis, and other remedies. I cannot discuss, your time is short, but there was a significant, if you see, there was a significant regression in all metastasis everywhere. Psoriasis case, he said, you are a last person. I'm going to commit a suicide. And finally, you see, I was giving him many remedies. And when we came to know that he was feeling bad because his father was in the old age home and he couldn't do because the wife was not allowing that father to come home, and he was helpless, caught between wife and father. And see the recovery, but he could sustain for such a long time because he was given partially similimum remedies. But finally, I always say and agree and never deny that the right similimum you may find at the first stage where you get faster results, at the later stage when you start treating in a zigzag way. This is a case of neurosurgeon's son left to die. Seventh case reported in the world of Job syndrome, and he improved with homeopathy, single dose of Medorinum 30 with other psoric remedies that had given. This is a case of leprosy. You see the change, you see the gone without. Now in leprosy, in allopathy, you have to take years of treatment together. And these were the marvelous recovery. This was a post-surgical neurological case, and was not responding to the treatment of allopathy. The CSF was leaking from here. It was a medical legal case treated by homeopathy. You can see within 10 days the recovery of the scar, and this surgeon was relieved from the medical legal. The infected scabies that you all must be getting. This is another case of tuberculoid leproma, AFB resistant case of tuberculosis. You can see no mycobacterium grown on culture after homeopathic treatment. You can see this thick walled cavity getting resolved just with homeopathic treatment, and the cavity gone. The resolution of the cavity is very difficult. As a pulmonologist, I had never seen, even in the pulmonology cases, cavity getting resolved. It was a seat of different infections. The thyroglossal cyst coming from Dubai, she was to go for a surgery. You see the homeopathic surgery and gone, and even the MRI done, CT scan done of this shows that it has been completely resolved. A case of CA esophagus with metastasis so big, no chemotherapy was given because yes, there was a large tumor size, cannot be resected, inoperable case. And finally, after the treatment, of course, I had to give multiple remedies, and he came and see the results in a span of 1 year's time. So 1 year's time, this case getting well. Only in the COVID period, we lost the case because there was no communication and the medicines could not reach. This is a case of another CS treated only. Now today I'm going to show, I've shown you only homeopathic cases because successful homeopathic prescription was a topic. Integrated cases, I can show you many, but there are cases, and this was again to be operated for surgery, and he responded to homeopathic treatment and he's fine. This is a concentric left ventricular hypertrophy, systolic functions with ejection fraction of 40%. All these cases, you can see that there is a marvelous recovery and patient becomes asymptomatic and living. This is the power of homeopathy. And he is an orthopedic surgeon who was saved from COVID time. And let us see, he has got his own COVID center, 2 centers he was operating in. And when he got a COVID, he resorted to homeopathy, and what he has to say. I think is the audio audible? Hello, audio is.
Yes, sir. Yes, sir.
No.
No, sir, it's not audible.
No.
What he is saying is, government should extend the services of homeopathy to integrate allopathy to save many lives. This is a statement directly from the horse's mouth. An orthopedic surgeon who is a entrepreneur and has got a multi-specialty hospital, 2-3 hospitals he has got, and it was all converted into COVID center. And he himself said because he got COVID and he got well in 3 days' time. That was his saying. And he is a neurosurgeon. Again, I think there is a problem of audio.
Good afternoon.
Yeah.
Myself, Dr. Sanjeev Huzur. I am a neurosurgeon at Jalgaon since 1994. This is story of my life, which happened to be on 5th of October 2011. When with my son, I went for swimming, and there was at the swimming tank only I had acute chlorine poisoning. I started suffocating. I had severe bronchospasm, hypoxia, disorientation. So I drove my car, went to Sayo Critical Care Jalgaon at the ICU, and at the doorstep of ICU, I just collapsed. My pulse BP was not recordable. I was taken inside. I was intubated and put on ventilator. And during admission, I had grade 4 cyanosis and started uprolling of eyeballs with decerebrate posture. So immediately allopathy started with steroids, ventilator, and my saturation was not coming up and my condition was very critical. Meantime, Dr. Jaswant Patil, my close friend, got the news and he immediately sent the medicines, homeopathy, at the ICU and started putting drops and medicines sublingually. Meantime, Dr. Jaswant's sister, Dr. Anjali Patil, she is a very good meridian expert. She came on in ICU and she started meridian therapy on me. She started removing my blocks called as meridian blocks. So initially she opened the lung point called as lung 1 point at lateral end of clavicle. Then she opened the bladder point at the middle end of scapula, and subsequently she opened the kidney meridian at the umbilicus and suprapubic area. Subsequently she opened Brahmarandra chakra, anatomically called as at antennal fontanelle, and she put the needles in antennal fontanelle. I was put on ventilator for 2 days and I subsequently started recovering. And on third day I was completely recovered. My vitals were normal. I didn't develop any complication, nor ARDS. Fortunately, fourth day I was so stable that one patient came in ICU and immediately he was required neurosurgery. So I myself did a neurosurgery on that patient and he got completely recovered. So this is the experience of life and death in my life, and this was possible only because of integrated treatment of allopathy, homeopathic and meridian therapy. It helped me in such a great way that my ventilator requirement reduced without any complication. I didn't develop ARDS and a complete recovery in sense of health, vigor, vitality. And it was possible because of integration of allopathy with homeopathy, meridian, and such integration must be evaluated by scientific research. Because at particular step, my FIT was not coming up in spite of PEEP of 5. So it was an aggressive treatment with allopathy and continuous homeopathy. My condition improved like dramatically anything. So I am once again thankful to team Jalgaon, Sayo Critical Care Jalgaon, and my close friend Dr. Anjali Patil and my Dr. Jaswant Patil also. I am very thankful both of them. Thank you very much.
Thank you very much for patiently listening, and I'll stop sharing. Can have it about you.
Good evening, everyone. Thank you, Dr. Jaswant Patil, sir, for a very beautiful and forthright presentation on many cases of homeopathy. Seldom do we have a speaker who comes out fair and honest and tells you what happens in practice. And there are several practitioners who have been doing certain things, but not many have been following a systematic approach like Dr. Jaswant Patil sir has done. And indeed, kudos to you, sir, for this great presentation in homeopathy. Also, the very fact that the homeopathic fraternity does not take it very kindly that a practitioner has been using more than one remedy at a time. That is probably one of the reasons why our presenters do not come forth to say so very honestly. All the same, it is the need of the hour for the development of homeopathy. To if there is need, homeopathy has to develop. There has to be some radical approaches. Yes, Dr. Jaswant Patil has found his calling during the COVID time, when having been a very successful homeopath all over with the classical homeopathic technique, he found that probably there is something wanted, something wanting as the need of the hour, and he changed his approach. And needless to say, you can see the success of his presentation and also his practice over a period of time. Dr. Patil, it has been well received by the homeopaths here and definitely on the online platform, sir. There have been a few questions for you, if I can ask them. Dr. Patil, sir.
Yeah, you can ask them.
Dr. Venkat Rajeshwar asks a question, sir. Role of tuberculum in tuberculoma.
It's a very good question. Many a times it has been seen giving tuberculum in active disease has sometimes deteriorated the case. That was the learning and teaching that I had pursued.
Sir, your voice is not audible, sir.
Is it audible now? Hello, is it audible? Hello, is it audible now?
Sir, sorry to interrupt you. Your voice is
Yes,
not
sir.
audible.
Yes, sir. Yes, sir. Audible, audible.
Is it audible now?
Sir.
Is it
Audible, sir.
audible, no? Because I think some people are not getting into
Sir,
this.
we are unable to hear you, please.
Is it audible now? Hello, is it audible?
Yes, sir. Audible.
Someone is saying not audible, so I'm confused. Hello,
We can hear you now, sir.
you can hear me?
Yes, sir.
Okay, I'll go ahead. See, tuberculum is seen that many times in active disease. It has been said that if you give in active disease, a patient can deteriorate. But to my clinical experience and to my homeopathic experience, I had seen that if tuberculum is exactly similar to the disease, it can cause a problem. But if it is not exactly similar, it will help for the faster recovery. Because I've seen in many cases, even in COVID cases, they were not responding. Fever was not responding. Tuberculum 201 dose was given and fever responded immediately. So it depends on the case, what the case is, what is the situation. But if it is exact similimum, I didn't get that case of the exact similimum, but I am of the opinion that it can happen. From the experience, I can tell you that exact similimum dose, even in cancer cases, I don't start with because it deteriorates the case, and therefore start with the emotional ailments from emotional affections, and then go gradually give the pathological remedy, then go gradually to the exact similimum state when the vital force improves, and then you get a better results.
Okay, sir. Thank you, sir. And Dr. Arun has a couple of questions, sir. He wants to know whether there was any parallel treatment apart from homeopathy in this tuberculum of the brain, the septic arthritis, and the other cases that you were presenting, sir, prostate cancer.
Yeah, I'll tell you. In tuberculoma, she was on allopathic treatment of anti-tubercular treatment, but she was not responding. And whenever the person, she had already got 6 months of treatment before, and she was not responding. Finally, she came to us that time. I said stopping the allopathic treatment would have been, sometimes if you don't get, your case goes into a problem, it can cause. So in such cases, I know that it is not working. And if the patient is having a less faith or is not very well acquainted with you, I usually don't take a risk. I say, okay, it's not working, as good as no medicines are given. Keep on giving homeopathy. And it's, you see now, with allopathic treatment, the tumor was increasing in size. And with homeopathy, immediately it decreased to 50%. The new lesion vanished, which is not possible with, because already 6 months of anti-tuberculosis treatment was not doing anything. So, in the case of septic arthritis, no allopathy was given. Only homeopathy was given.
Okay. Sir, he also has another question. Please share your view on the exteriorization in the terminal ill.
Terminally ill, I had showed you the case of prostate cancer. Okay. In case of prostate cancer, and in many cases, when you go by the zigzag ways in the treatment given in the organon, the zigzag treatment, whenever the symptoms are not very clear, and you go on seeing what comes up, and you should, therefore, you have to be very close to the patient, close observation. Give a medicine, observe after 1 month is a wrong practice. You have to observe every 7 days. What are the changes? Sometimes you have to ask the patient, any new symptoms come, immediately call me. Give me a missed call. I always call back the missed calls, because I know that there are important things that patient may not communicate with you, and this patient will deteriorate. So in homeopathy, you require a very meticulous approach. And then as per the symptoms they come at, as I had shown you, from lungs, it went to the bladder, from bladder, it went to the skin. So exteriorization happens in 80% of the cases when treated properly with your mind and eyes open. And the way the exteriorization happens, if they interfere with any other treatment, like applying on the skin anything, I've seen that patient going again back into the bad problem. So these are the important things that we must here. We have confirmed the rules. I think most of the homeopathists confirmed the rule that going to a dermatologist or applying anything on the skin has spoiled the recovered cases.
Okay, sir. Sir, what has been your experience in giving remedies where the relationship between the remedies, do they matter when you have to consider, or it is just a symptomatic application at that point of time?
Yeah, this question was troubling me for a longer time. As I was seeing the remedy, I used to always keep a remedy relationship chart in front of me, and afraid of giving this, that follows well inimical remedies. And many times, because there is nothing certainly written in homeopathy, it was all experience, trial and error methods, and finding out and finally coming to a conclusion that this is not the case with everywhere. In some one case, you get this response. That doesn't mean that it applies to all the cases. Whereas again, in the remedy relationship, I have seen one remedy that is written by one author as inimical, and same remedy written follows well for 1 mark and complementary for another mark. So I said, well, how can it happen? It is inimical also and follows well also. So then I realized during practice, you have to judge the condition, see the condition, whether it is going to complement what symptoms were produced by this patient and what symptoms produced by this remedy. They are exactly similar. Then yes, you might get an inimical reaction, but not always. So every case is different, and you have to be judging the case and coming to a conclusion with your logical and rational thinking.
Okay, sir. Thank you so much, sir. And considering the fact that you've been a very classical prescriber for at least maybe pre-COVID, sir, and post-COVID, it's a different scenario. Of course, you clearly said wherever the classical prescription is required, you do stick to that as and when necessary. What is your experience about the suppression with homeopathic remedies?
Suppression is one thing that haunted me for a quite long time, and I was always afraid of using the remedies. But here again, I saw that the patients, you saw that prostate case cancer is going into respiratory difficulties. And I would think that it is a separation, but it is an expression of the inner layer that comes up, because there was one case. I was treating a mother of a collector of Jalgaon, and she had an eczema on the legs. After treating that knee disease, it was exteriorized. And then I said, don't apply anything, don't take allopathy, don't go to a dermatologist. But there they went to dermatologist, and I was following this case for more than 10, 12 years. And she was here in Artin, fine, nothing happened. Said, where is this log on? Why she is not suffering? Then I realized, if the mind becomes perfectly well, then nothing happens. If the mind is disturbed, again the things can happen. So it was always a confusing thing. Even today, we do not know. But now I'm seeing, after changing the attitude and my directions, that no, what is there in front of you, treat that. Whatever comes, you treat that also. There will be no, finally the patient goes to the final cure. And for that, you have to be very vigilant.
Yes, sir. Thank you so much, sir. And do you think, sir, with this experience, you would consider treating only one-sided diseases, or treat diseases where it is difficult to have a good prognosis? You would want to give such application of remedies only to such diseases, or even the routine ones?
Routine disease first I try. Now, fortunately and unfortunately, I can't tell, but I get only one-sided and all gone up cases. The whole 99.9% are this type of cases that are coming to me. Small cases are not coming, but where they are coming, that is for all others, because I also gone through that stage. When these, always try on a classical basis first, see the response. If you are getting well, don't go for the multiple remedies. Only in cases where you're not getting response or you're not finding the way out, there you have to be logical and rational to change, like I changed myself. Even today, I prefer, in small cases, giving a single remedy. And in some cases where I'm afraid that he will go worse, then you have to go. Because even in acute cases like in viral, they land into problems so fast. I got one ICU case of COVID followed by myasthenia gravis, COVID followed by GB syndrome, and gone into different types of problems, into respiratory failure, into ICU, finally not responding and coming back with the zigzag treatment. There I was afraid of suppression, that this will go. Discharges are coming from the ear, but they are so painful that there is a possibility it will go into the brain, but it never happened. With that, the discharges came down slowly. Even the skin lesions came down slowly, and the lumps, they used to come, lymph nodes from the otitis interna also it had gone to. So it was a terrifying experience for me, but I kept my patients, and the relative of the patient was very, very watchful. I'm thankful to him to give me the perfect history, and we could bring that case out. He's a live example. I have presented in some other seminars this case, how this case can be brought out. Even in my own case, I developed an COVID with 4 patches of pneumonia, and bilirubin rising from 0.8 to 4.5 in just 3-4 days time. CRP was 265, and I was into a delirium. And my daughter, she's an dermatologist. She says, I told her that, beta, if I fall sick, who will treat me? Because my way of treatment, many people don't follow. And I want myself to be safe. But if I'm not on my senses, what you will do? So for my sake, you please learn this homeopathic things. And she learned. And when I was in a comatose state, she gave that protocol, and I came on my senses. Now, I thought, what you have done? She said, Papa, your fever was not coming down. So I thought you had written, if the nothing is responding, you tuberculinum. So I thought for the tuberculinum, there was no 3200 available in the home. So 1M was available. So I gave you 1M, and your fever came down immediately. And after that, I was seeing that I was into a state where I was going into a delirious state, and I immediately saw a rubric in Pathak that delirium during septic state, because I was sometimes hearing some voices, I was not on fully conscious state, and stramonium 200 that immediately brought me to much more better state, but still the pneumonia was lingering. And I called up my friend Dr. Liaquat. He said, you take Ignatia. For emotionally, it worked well and gave me certain things. But finally, Dr. Habu, I called him. He said, your pathology should get well. Bilirubin had come down with chilidonium. Immediately fast in 7 days time with chilidonium and zincum mur, what he prescribed exactly on the pathology. The lung pneumonias they cleared, and I was absolutely okay on the 7th day, and all the radiological shadow vanished on 12th day. It was such a surprising. I had a full confidence. I told my daughter that, look here, if you send me to, and everyone was, there are 8 allopaths in my house, all the near family members. They said, take him immediately. We'll have to do for bilirubin so fast rising, so we have to filter the bilirubin. He will require a ventilator, this, that. I say, my dear daughter, if I have to die, I would prefer to die by homeopathy rather than taking me to allopathy, because for 5 years I've worked in ICU. I know at my case, like my case, I've handled hundreds of cases. I'm not going to come out. There I'm 100% going to go away. And here there is 1% chance to believe. I will not risk my life. I will not risk my life. That much faith I have got in homeopathy. Only homeopathy can save me. And today I am talking to you, and I am fine and with you because of homeopathy. I always thank homeopathy. Has saved many members in my family during COVID time. I have not lost even one.
That's awesome, sir. And of course, you deserve a healthy life ahead too. And further to the request, we also feel that you should write a book on your experiences, and your style of approach should be followed by many other homeopathic physicians in the days to come.
I'm finding a good writer for me. I am very, I would say, miser in writing. I am writing is something which my speed of thought and my hand and pen doesn't work faster. The thought goes
So
to
that otitis, what did you prescribe, sir? Otitis, you said, no, brain affection, otitis, it came back.
that there we prescribed capsicum.
Ah.
Capsicum was one of the remedy that worked very well in that, because he was losing his son who was there. And you know, the mastoid, there was a caries in the mastoid region. There, if you see the pathological remedy, capsicum works better. Also had given him other abscess remedies of Heper sulf. And when the flow was starting, that time calcareous sulf changed to that, from Heper to calcareous sulf. So, you know, these type of things that help me to bring out the patient fast and very nicely.
Thank you, sir.
About this pneumonia, sir, about pneumonia, that one child had come to me from Bhaktivedanta Hospital, Mira Road. That was in 97-98, bilateral pneumonia. And the mother was holding the child and flapping off the Ella Nezai and drowsiness and all that thing. A single remedy, antium-tart, I gave that child. So both, it was in 98, so both side pneumonia cleared up in 7 days.
Yeah, I'll tell you one thing. Basically, when you get such a typical thing, now how much was the pneumonia? What stage was of the pneumonia? Whether it was in the first stage, second stage, third or fourth stage. So if it goes to the consolidation stage, then antium-tart would not work there. So the chilidonium will come. So, you know, when we set up such things, that flapping of the align even seen in the last stages of pneumonia I had given and it had not worked. But in the early stages of pneumonia, you one dose and it works wonders. So it depends on what stage the patient comes to you, at what grade he comes, what is the pathology deep inside. So all these factors make your successful prescription. But if you get this, I used to always feel, okay, I got, now I'll tell you one case of my auntie. She had an hemorrhagic pancreatitis. Okay. And she was admitted in ICU. Of course, it was a necrotizing pancreatitis. So the septicemia and all complications that had gone to pleural effusion, blood in the, I put in a needle with in the pleural cavity because I was a chest physician and she was in ICU. We draw the blood, it was pleural fluid was all bloody. So the bad necrotizing pancreatitis. And I was just a budding homeopath that time, more going on a clinical basis. So I was treating, giving Iris V, Belladonna, Bryonia, so many remedies I had given. They had worked. The patient was comfortable. Patient was stabilized. I got a time. My uncle said, ki, we have to shift to Mumbai. I said, the other surgeon said she will not reach Mumbai also. So anyway, we have got only 24 hours in our hand. And I was sitting on the workstation of the ICU and just wondering, ki, what should I do now? And immediately one man was started going, taking a fan to I said, where are you taking this fan? In the ICU, there was already an AC fan. Who is requiring fan? And she said, put a fan here and put it on my face. I gave her Carbovage 30 and she recovered faster and better. But if this was not there when she was admitted. So you know that the stages they come at that particular stage when you give that. And I had given the same Carbovage remedy to that person in a severe pancreatic stage, even where she was air hungry, when the oxygen had gone very down, it didn't work. Like even in COVID cases, Carbovage worked on many cases where there was a hair hunger, but not in all the cases. So there is always a change, and therefore we have to be very, very vigilant. We have to be open and not make fixed opinions. And we can try, but if we don't get immediately change. Thank you.
This Carbovage, na sir, Carbovage thing, na. So that 1995, that Dr. Samant was there, na, Organon HOD, Ville Parle Homeopathic College. He said with his sister's reference in 1958-59 that his sister had a typhoid fever, and Dr. Samant's father was MBBS doctor from KEM Hospital. That was in 1955, practicing at Malad. So they refused, KEM Hospital treatment refused. And then Samant said, now what to do? So in those days, the Dadar, Dr. Das Gupta used to practice. So Das Gupta came home. Samant said there was no auto rickshaw. That time, you know, that Tanga was there, Goda Tanga. Samant sir said, I brought him from Bandra to Dadar, Dadar to Bandra in Tanga, and he saw the patient. The pulse was almost imperceptible.
Your name is not
Cold sweat.
here, which shows as Dr. Samson. Thank you so much. Thanks for the conversation and also the good idea of what happened in the past. And I'm sure Dr. Jaswant Patil has a good idea about it. And Dr. Patil sir, Dr. Venugopal has a question for you. What's your experience in treating metabolic disorders, diabetes, hypertension, and some other conditions like glaucoma with homeopathy?
See, this is a very big question. Cannot be answered in a short time. I have seen the metabolic disorder to the last stage, and I have fought till the last breath of the life. In some cases, I have succeeded. In some cases, I have not succeeded. But it is a terrific experience, and there you have to be means you see the response, use and see immediately. Now there is one case which is going on. At the last stage bleeding. Gave hemamylase, pilifollium, and the bleeding came down. Then the discharge was more, abrotanum 200 discharge was brought down. The septicemia reversed, the WBC count came down. Again, then he started going into fall of BP, and he was not responding to Cactus G, Digitalis, Loras Rhesus. So I had to imagine now what this man's BP must have been down. Because of low CVP, that is hypovolemic shock, Veratrum works better. If it is CVP is normal, still that means whether it is a left ventricular failure or circulatory failure. If it is a general shock, Camphora 200 works. So you know the clinical conditions that time, what is prevalent, and you have to give and see the response. You may be wrong. You give a wrong remedy, it will not work, but it will not do any wrong thing in the acute phases. So bindas dene ka and see, and the response should be within 10 minutes. If you don't get a response in 10 minutes, I can tell you that your remedy selection was not in these severe metabolic cases. And even in the diabetic cases with sugar of 400 and 500, abscess without antibiotic has resolved. Whenever there was a ketoacidosis also, it resolved, giving just a simple soda bicarb and monitoring the case with allopathic part and homeopathic integration. So in such cases, you have to be very, very rational and logical and quick in acting.
Yes. Thank you, sir. And our Joint Secretary, Dr. Annapurna, has a question for you, sir. About she wants you to throw a ring in the chapter of posology about potency and repetition, sir.
Potency and this, that was always even a problem for me. I can understand her plight, but I'll tell you, I'll give my experience. So whatever my experience is there, I can share. There are the difference of opinion, but whenever you want a pathological remedy, it should be in 60 or 30 pathology prescriptions. And when the vital force is low and pathology, these things are not acting, I go to 200 and I get a response. And when the vital force has gone down, 1M, 10M, CM also works, where this 200 and will not work. So the different cases at different point of time, there is a different observation and different. So there is no one single rule, and that is what is missing in homeopathy. Therefore, many a times, many homeopaths are confused, even stalwarts are confused when it comes to treating their near and dear ones or themselves. But if you are not getting response and if you are sure about the remedy, go on increasing the potency as fast as possible. And if even then there is not even 5%, 10% response, that means your selection needs to be changed.
Hello, sir.
Yes.
What about your view regarding 50 millismol scale prescription in chronic cases or acute cases, sir?
See, basically, I have not worked honestly very well with 50 millisieverts potencies, but wherever I am afraid, like I am very much afraid of phosphorus, causticum, deep acting remedies. There I have tried to give, but I didn't see any change in them. So I'm not a right person to answer this question, because this is a 50 millisievert potency, is so low potencies. That is actually it is high, but the response that is required faster within minutes, that I could not evaluate here. For the
Right, sir. Have you tried with 50
the Vice Principal of Davis Homeopathic Medical College, interacting with our speaker. Sir, you've been a researcher and now you are very much on the panel of CCRH. How quick can we expect to see some good research which is going to be honored and accepted by the scientific community, number one? And how quickly can we see any homeopathic papers coming up with saying more than one remedy has been used and the patient has got out of carcinoma?
Yes. See, this this was my first meeting about 2 months back, and in that I had seen there are a lot of research projects, and I suggested that where we should show the homeopathic remedies are acting in a terminal cases, in a very chronic cases, CKD cases, cancer cases, and not take these simple cases and show the effect of homeopathy. And accordingly, the committee members have approved many good projects. But there is one problem which the office bearers have put a concern, that the fundings given for research in homeopathy is very less. Some research papers are not getting fund sanctions so easily as Ayurveda gets it. So there is always a problem of the homeopathy is looked at a other side, that more importance is given to other things and less budget is there. But with whatever budget is there, I am seeing Dr. Anil Khurana sir, our CCRH chairman sir, they are doing a wonderful job. तो डॉक्टर कौशिक सर ने तो बताया कि हम जितना हो सकता उतना करेंगे, और वो I have seen them working very hard. They are really working hard and they have come out with very new publications. Only thing is public is not aware. So you have to go to the CCRH website, and so many things, new things, protocols and everything they have said. I talked about this, your last question, that 2 or 3 remedies together placed at a different has to be studied, that together what is in the Allen's combinations number 27, number 14, are they really effective or not? Rather than rejecting them point blank, we have to study, research, find out and do. So one thing that came to my mind is that now when the homeopathy is prepared from a plant, so there are so many alkaloids in that, not a single, like in allopathy, one single molecule is picked and developed and seen for the properties. Here, the whole plant is been put, the medicine is, so which molecule is acting where and what is not known. So that is also a mixture of so many molecules. So these molecules have to be separated and each should be separated, separately researched in a homeopathic point of view in human provings as well as physiological and biological and immunological levels and at a cellular level. So we get at the scientific as well as on the human provings on the for the symptom basis. So we can link this particular symptom with pathology. So from what is symptom? It is a language of the body to tell you this is a pathology inside by giving individualized symptoms. And when this will be done and treated, it will stand number 1 in the world. I can say, I can vouch, I got so much confidence in homeopathy that homeopathy is a real science. I have been a doctor of all the pathies, but I always put homeopathy is my number 1 approach. My number 1 approach because it has worked wonders. I am just not boasting homeopathy, but I am telling the honest opinion. I don't deny allopathy. Allopathy has got its importance at its own level. But when the things are there, when the hands are up, then homeopathy works. So why not in the early stages, we can save so many lives. The mortality rate will come down, morbidity will come down. And that I have experienced at my personal level in my own nursing home and ICU.
Great, sir. Thank you so much, Dr. Jaswant Patil, sir. It was an awesome experience for all the listeners and who have seen your presentation, sir. And we know that COVID was a great challenge, not for just the human society, but also homeopaths in particular. And we have seen only good practitioners survive to tell the tale, not literally in the sense, but as far as homeopathic practice is concerned. And it has also thrown out some good homeopaths like Dr. Jaswant Patil, sir, with and we are very happy to hear you, sir. And we look forward to your continued work for the cause of homeopathy with great hope and affection and regard in the days to come, sir. Thank you so much. I request our executive committee member, Dr. Shruti, to take over and the proceedings for a minute.
Thank you all of you.
Thank you, sir. Now I call upon Dr. Raghuram, sir, please present the vote of thanks.
Dr. Jaswant Patil, sir, thank you for your wonderful speech today, for all the wonderful presentation of the cases, and hopes it inspires a lot of many homeopaths, young budding homeopaths to believe what homeopathy can take care of. We also thank Dr. G.R.Raman, sir, for today's oration, and also Team HMAT for conducting such a wonderful seminar. Thank you.